In old age, if you do not masturbate, it will lead to certain consequences. They may not share this information during your typical appointment, but I'll be straightforward. If you've ceased the practice of masturbation in your later years, it's possible that your body is beginning to experience some changes, and you might not even be aware of it. No, this isn't some inappropriate subject or casual banter. This represents genuine clinical and physiological reality. Neglecting this reality can lead to severe repercussions, impacting not only your sexual well-being, but also your cognitive function, cardiovascular health, sleep quality, immune response, and overall self-perception. I am Dr. Olivia Carson. I have over 30 years of experience working with aging patients across the country, focusing on men's health. Throughout my professional journey, I have focused on understanding the transformations that occur in the body with age, particularly regarding intimacy, hormonal shifts, and sustained vitality. One of the most significant, unnoticed dangers I've encountered is this. Many older adults neglect their sexual health. This represents a crucial element for their comprehensive health. You might find this unexpected. Masturbation is not merely a remnant of youthful urges. This is truly one of the most effective mechanisms your body retains as it ages, capable of managing hormone levels, enhancing cognitive function, safeguarding prostate health, and even combating feelings of depression. If you've halted or haven't begun, the cost you're incurring could be significantly greater than you realize. In the following moments, I will guide you through the specific changes that occur within your body when you cease the practice of masturbation as you age. What I present could profoundly alter your perspective on your well-being and self-image from this moment onward. Before we begin, if you value maintaining your vitality, wellness, and autonomy as you grow older, be sure to subscribe and activate the notifications so you won't miss essential guidance designed specifically for you. If this message speaks to you, please type 1 in the comments. If that's the case, please enter 0. Your insights are invaluable in shaping content that genuinely promotes your health and wellness. Let's start with the first, and possibly the most neglected outcome of abstaining from masturbation in later years: the subtle effects it has on your prostate and urinary health. 1. Decline in prostate health and urinary performance. When I first began my medical practice over 3 decades ago, I didn't expect so many of my patients to open up about something so private, yet so critical to their health. The subtle decline of intimate practices as individuals age. One gentleman I recall distinctly sat opposite me and remarked, "Doc, I just concluded that I no longer required that aspect of life." He was in his early 70s. He was fit and sharp, yet he found himself waking up 4 or 5 times each night to use the bathroom, leaving him puzzled about the reason behind it. What he was unaware of, and what many men fail to recognize, is that consistent ejaculation, including through masturbation, is vital for maintaining proper prostate function. The prostate is an active, vital organ within the body, not merely a passive gland. It generates fluid, it undergoes expansion and contraction, and like any system, it experiences issues when overlooked. In the absence of consistent stimulation and release, prostate fluid may become stagnant. The lack of movement fosters an ideal setting for inflammation and swelling, leading to pressure that can interfere with various functions, including urination and sexual performance. You may experience a sensation of increased bladder pressure, a diminished urinary flow, or a persistent feeling of fullness that doesn't seem to subside. These are not merely inconveniences. These serve as preliminary alerts, and this is where the risk lies. Chronic prostate congestion can subtly progress into more significant issues such as benign prostatic hyperplasia, commonly known as BPH, impacting nearly 50% of men over the age of 60. If not addressed, it may result in urinary retention, bladder infections, and potentially necessitate catheterization. The individual I referred to earlier, he ultimately required surgery to alleviate the pressure, a situation that could have potentially been prevented had we implemented straightforward, consistent habits earlier on. Frequent ejaculation aids in cleansing the prostate, eliminating stagnant fluid, and lowering the chances of accumulation. Research indicates that men who ejaculate 21 times or more each month have a notably reduced risk of developing prostate cancer compared to those who do not. Allow me to clarify this point. This isn't about regaining youth or exhibiting any obsessive tendencies. This is grounded in reality. This pertains to functionality. Regarding the utilization of your biological functions to safeguard your health in the most straightforward and organic manner available. Ceasing to engage in masturbation during later years goes beyond merely dismissing enjoyment. You're exposing yourself to discomfort, swelling, and a slow decline in mastery over a fundamental bodily function, voiding. I've encountered individuals who have developed a fear of stepping outside due to a lack of confidence in their bladder control. I've witnessed resilient individuals brought low by restless nights and daytime worries due to a condition that could have been addressed or avoided with something as straightforward as regular self-care practices. Indeed, the psychological impact is significant too. Experiencing a lack of control over bodily functions, having to plan bathroom visits meticulously, feeling anxious about extended travel, and waking frequently during the night can significantly impact your sense of autonomy. It's more than just your prostate. Your autonomy is paramount. However, this is where it becomes even more unexpected. What begins in the prostate often extends beyond its confines. The subsequent outcome impacts not only your physical health, but also your mental well-being. Once it starts, it can change your cognitive processes, emotional responses, and memory retention. At times, the effects can be challenging to undo. Let's discuss the effects on your mental clarity and cognitive function when self-stimulation is removed from your daily habits. If you find these insights valuable and they resonate with you, please type the number 1 in the comments. It indicates that you remain present, actively participating, and appreciating this communication. Now, let's proceed to point number 2. Recently, a patient in his late 60s visited my office expressing concerns about cognitive fog and diminished mental clarity. He had no issues regarding his prostate or his energy levels. He just mentioned something that resonated with me. I'm not feeling quite like myself lately. I enter a space and lose track of my purpose for being there. I often find myself losing my train of thought mid-sentence. I once had such clarity of thought. Could this simply be a result of aging? It's a query that comes up more frequently than one might expect. Indeed, the passage of time naturally introduces certain transformations. However, many individuals, including those who are well-educated and prioritize their health, remain unaware that engaging in sexual activity, such as masturbation, significantly contributes to the preservation of brain function. Let me explain the process. During self-pleasure, the brain produces a mix of neurochemicals, dopamine, serotonin, oxytocin, that are closely associated with memory, concentration, and emotional balance. These substances go beyond providing temporary pleasure. They contribute to the development and safeguarding of neural connections. They enhance circulation to the brain. They lower cortisol levels, the stress hormone that, when elevated, can harm brain cells. When you cease the act of masturbation, particularly for an extended duration, the natural surges of brain protective chemicals occur less often. Over time, this can diminish your cognitive sharpness. It might become more challenging to focus, to absorb information, or even to maintain motivation. It takes time to see results. It gradually makes its presence known. Initially, you lose track of names, then you lose track of the day, then you begin to question your thoughts completely. In that uncertainty, a more troubling emotion can emerge: fear. I've observed individuals descend into anxiety and depression due to the misconception that they were experiencing a decline in vitality, when in truth their minds were deprived of necessary stimulation and chemical equilibrium. In males, there is an additional hormonal change. The hormone associated with memory, decisiveness, and vitality may experience a more rapid decline when sexual activity approaches a minimal level. Testosterone encompasses more than just sexual desire. It's about your identity, your resilience, your insight. Indeed, regular and healthy ejaculation can play a role in maintaining and regulating testosterone levels as one ages. Research has started to connect diminished sexual engagement in older individuals with initial indicators of cognitive deterioration, including dementia. While I'm not suggesting that ceasing masturbation leads to Alzheimer's, I do want to make this point. When the brain lacks stimulation, emotional release, and hormonal support, it becomes increasingly susceptible. It falters in its rhythm, its resilience wanes. For numerous individuals, the fog can become dense enough to alter their lifestyle, their interactions, their thought processes, and their self-perception. A gentleman shared with me that he ceased attending his chess club due to his inability to concentrate on the game any longer. A retired educator expressed that he felt empty each morning. These issues did not necessitate medication for memory concerns. Their manifestations indicated a disconnection from physical intimacy, even in relation to oneself. And here lies the unfortunate aspect. These can be prevented. There's no requirement for costly medications or treatments. At times, it begins with re-establishing a connection with your body, providing it the care it subtly seeks. When you engage the body, you activate the mind. However, this decline in cognitive clarity is merely one aspect of the overall picture. What are the next steps? When emotional balance begins to erode and your mood starts slipping without warning, it can become increasingly subtle, more damaging, and much harder to discuss. Let's explore how relinquishing self-intimacy can quietly invite depression into your daily life. 3. Increased feelings of depression and emotional detachment were evident in a patient I once treated in his early 70s. A widower now enjoying retirement and in relatively good health approached me not with a physical concern, but rather with an issue he found difficult to articulate. He met my gaze and stated, "I no longer feel anything, not sorrow, not happiness, simply unremarkable." He took a moment before asking, "Is that typical for someone my age?" That question continues to resonate with me as I encounter different versions of it frequently. What many individuals believe is merely a consequence of getting older. The lack of vitality, the sense of detachment, and the gradual diminishing of feelings often stem from a more profound physiological issue, one that is frequently overlooked: the decline in sexual stimulation, especially in terms of self-pleasure. The reality is this: when you cease to connect with your body in a personal, physical manner, your emotional state may start to change subtly, yet significantly. The act of masturbation encompasses not only physical sensations, but also serves as a means of emotional expression. It's your body's natural mechanism for alleviating stress. At the peak of sexual excitement, the brain produces potent substances such as oxytocin and endorphins, which serve as natural mood enhancers that help alleviate anxiety, stress, and feelings of sadness. Eliminating that outlet from your life, particularly during periods of stress, loneliness, or grief, can lead to emotional numbness, which may develop into a more serious condition, such as depression. I've observed it develop gradually. Some individuals may cease the practice of masturbation following the loss of a partner, or due to the belief that it is no longer suitable for their age. Time stretches on, with weeks evolving into months. They tend to exhibit a more subdued demeanor, becoming increasingly reserved. They become disengaged from their hobbies and even from discussions. Some individuals experience excessive sleep, while others do not get sufficient rest. Alterations in appetite. Life begins to take on a dull hue, and the harsh twist of fate. Many are unaware of the link. Individuals often hold themselves accountable, attributing their feelings to factors like age or circumstances, believing it's just how life has unfolded. However, what they truly overlook is the fundamental yet crucial practice of engaging with their own bodies, not merely for enjoyment, but for the sake of emotional well-being. In older adults, depression frequently goes unrecognized, as it may not always manifest as feelings of sadness. At times, it manifests as tiredness, irritability, a sense of disconnection, or a lack of drive and desire. While medication and therapy serve as valuable resources, I can't emphasize enough how many individuals I've assisted by motivating them to rediscover their physical self-intimacy. A man shared with me that he felt rejuvenated after starting to engage in self-exploration regularly for the first time in years. He mentioned that it not only elevated his spirits, it served as a reminder that he remained a person, not merely a vessel awaiting its end. That small act restored a part of him he believed was lost for good. This is the key point I want you to grasp. Masturbation in later life transcends notions of fantasy, lust, or shame. It's essential to maintain the well-being of your emotional system. It's about allowing your body to experience, to let go, to reconnect with the essence of being in the moment. Because when that connection is lost, it goes beyond just the risk of sadness. You're putting yourself at risk for isolation, emotional decline, and in certain situations, even losing the desire to participate in life. However, the emotional repercussions are not the sole considerations. As the nights extend and your rest becomes increasingly disrupted, another concealed expense starts to escalate. One that can influence your cognitive function, your body's defense mechanisms, and your susceptibility to significant health issues. Next, let's discuss how the lack of sexual release could be depriving your body of the restorative sleep it truly requires. If you're still engaged and appreciating these insights, please type the number 1 in the comments to indicate your presence and that you're following along. Now, let's proceed to point number 4. 4. A gentleman in his late 60s approached me after experiencing months of inadequate sleep quality. He appeared fatigued, ashen, and exasperated. He mentioned that he falls asleep but wakes up at 2 a.m. as if he's been shot out of a cannon. Then I simply remain there, gazing at the ceiling, anticipating the arrival of morning. We conducted evaluations. His lab results were normal, no signs of apnea, and no significant concerns were noted. However, when I softly inquired about his personal life, he averted his gaze, "That aspect of my life," he murmured, "has come to an end." However, that aspect of him, which he believed had diminished, might actually be the crucial element his body was desperately seeking: restorative, uninterrupted rest. Rest is more than merely shutting your eyes and remaining motionless. The process involves intricate hormonal interactions. One of the most effective natural triggers for deep sleep is often overlooked as we get older: climax. At the peak of pleasure, your body produces a blend of oxytocin, prolactin, and endorphins, a remarkable natural formula that transitions the nervous system from a state of stress to one of relaxation. Simultaneously, the hormone linked to anxiety and alertness, cortisol, experiences a significant decline. Your breathing becomes more measured, your heart rate stabilizes, and your muscles ease into relaxation. You achieve the optimal condition for restorative slumber. Now envision eliminating that process from your life completely. Not merely once, but over the course of weeks, months, and even years. That's the outcome when older individuals cease engaging in self-pleasure. The body forfeits a vital resource it previously depended upon. What occupies that space? Frequently, it manifests as a sense of unease, exasperation, restlessness, and discomfort. Some individuals resort to sleep medications. Some individuals just resign themselves to fatigue as a standard part of life. However, the implications of inadequate sleep extend well beyond merely experiencing fatigue. Prolonged lack of sleep compromises the immune system, hastens cognitive deterioration, elevates the likelihood of heart disease, and heightens susceptibility to anxiety and depression. In older individuals, it additionally plays a role in falls, cognitive challenges, and a decline in autonomy. I've observed individuals who previously enjoyed vibrant, fulfilling lives gradually retreat, not due to any significant health issue, but rather because they were just too fatigued to operate effectively. And this is where it becomes quite concerning. Numerous individuals were unaware that they were lacking the essential element that once aided their sleep. Neither a medication nor a dietary aid, but rather the body's inherent mechanism for release. Engaging in masturbation might appear to be a minor or inconsequential activity. However, for certain individuals, it can mean the distinction between 4 hours of disrupted sleep and 7 hours of restorative, uninterrupted slumber. A patient shared with me that after rediscovering this aspect of himself, he now sleeps as soundly as he did 3 decades ago. I was unaware of how essential that relief was for me. I believed it was simply a matter of aging. That is the issue at hand. Many individuals confuse biological neglect with the natural process of getting older, leading to silent suffering. If you find yourself lying awake at night, mind racing, muscles tense, and the hours stretching on, consider this. When was the last time your body experienced complete relaxation, completely release? At times, the solution may not lie in a new prescription or a relaxation tool. At times, it's about reconnecting with a familiar pattern that your body still recognizes if you allow it to surface. However, while a lack of sleep can subtly diminish your energy and cognitive sharpness, the next effect we will discuss is even more tangible. It manifests in the weakening of your muscles, the alteration of your balance, and the unexpected challenges with your bladder. Let's discuss the effects on your pelvic floor and circulation when intimacy is no longer present. 5 years ago, I had the opportunity to care for a retired firefighter in his 70s, a man who had always taken pride in his physical strength. He presented with concerns regarding mild urinary leakage and reported experiencing discomfort in his lower back and hips when standing for extended periods. "It's unusual," he remarked. "I sense that the core strength of my body is gradually diminishing." What he was describing wasn't merely the passage of time. It was the gradual, subtle decline of his pelvic support, and he was not the only one experiencing this issue. The pelvic floor consists of a set of muscles located at the base of your core, providing essential support for your bladder, bowel, and sexual organs. Many individuals tend to overlook these muscles until an issue arises. Incontinence, bowel irregularities, difficulties with sexual function, or pain during ambulation. However, this is the aspect that frequently goes overlooked. Consistent sexual activity, such as masturbation, is essential for maintaining the strength and function of those muscles. During arousal and orgasm, the pelvic floor experiences rhythmic contractions. That contraction serves a purpose, focusing on functionality rather than appearance. It enhances circulation to the lower body, fortifies the internal support structure, and ensures effective communication between nerves and muscles. It's not solely focused on performance, it's about safeguarding. When you cease regular masturbation, those muscles don't simply become inactive. They start to diminish in size and function. As circulation diminishes, tissues lose their elasticity, nerve responses weaken, and ultimately, you may encounter symptoms that catch you off guard. Experiencing frequent urges to urinate, slight dribbling post-bathroom use, challenges with gas control, or discomfort during movement. This may result in a significant decline in sexual performance for men. For women, it may result in dryness, tension, and discomfort that can hinder all forms of intimacy. I've observed individuals who once enjoyed their independence start to shy away from social gatherings due to concerns about their bladder health. I've observed individuals feeling ashamed about unexpected leaks during coughing or sneezing, unaware that this often stems from something they've overlooked for years: the circulation and muscle activity in the pelvic area. There's an important point I want to express clearly. Overlooking this aspect isn't merely a matter of inconvenience. It can result in falls, incontinence, and a loss of dignity that is undeserved by anyone. It's possible that you may begin to depend on pads, specialized undergarments, or careful planning regarding bathroom access, all due to a lack of necessary stimulation and support for the lower part of your body. As time progresses, the difficulty in reversing the situation increases significantly. It truly saddens me to see so many individuals enduring their struggles without seeking help. It often remains unspoken. Many individuals experience feelings of shame, confusion, or believe that these issues are simply a natural part of aging. However, I must emphasize this point strongly. Your body continues to strive for optimal function, even at the ages of 70, 80, and beyond. One of the most effective and natural methods to support this, without the need for medication or equipment, is through safe and regular intimate stimulation. When you restore that connection, you're not merely stimulating enjoyment, you're regaining vitality. You're directing blood to the areas that require it the most. You're activating sensations, preserving vitality, and reinforcing the importance of your lower body. While this consequence is tangible, the subsequent one delves even further. Your body's immune system, including its cellular defenses, plays a crucial role in safeguarding you from illness. The processes occurring in your bloodstream post-orgasm could be among the most significant, yet frequently neglected health benefits. let's discuss how a lack of sexual activity might be subtly undermining your immune system. 6. A few winters ago, one of my longtime patients, a man in his late 60s who had always been relatively healthy, came in looking drained. He had experienced illness 3 times that season, dealing with persistent colds and mild infections. He mentioned that he would typically recover within a day or two. Now, even the slightest ailment takes me out for weeks. After eliminating the common factors such as diet, sleep, and medication, I carefully inquired about another aspect of his life. Have you engaged in any sexual activity recently? Is that possible even when one is by themselves? He offered a hesitant smile, then slowly shook his head. No, it hasn't been that way for quite some time. That aspect of my life has simply come to a close. What he failed to understand, and what many individuals overlook, is that sexual activity, including masturbation, directly influences the immune system. That is not a metaphor. It's the study of living organisms. During sexual arousal, particularly at the moment of orgasm, the body experiences a significant release of biochemicals. It's not only about dopamine and oxytocin that contribute to your well-being. There are also genuine immune-boosting substances involved. For instance, there is a notable increase in immunoglobulin A, or IgA. This antibody plays a crucial role in protecting your body from viruses, bacteria, and infections, particularly within the respiratory and digestive systems. Endorphins are released, which helps to reduce inflammation and promote healing. Now envision living without that enhancement. Not merely for a week, but extending over months or even years, your body begins to diminish one of its simplest, most innate protections. At a stage in life when your immune system is naturally diminishing, removing this mechanism is akin to disconnecting the batteries from your smoke detector. Initially, you may not realize it, but when challenges arise, your body may not react as it once did. I have observed this unfold in real time. Individuals who have withdrawn from their intimate lives frequently notice an increase in illness, slower recovery times, or exacerbations of chronic inflammation. Even if they don't realize it, their body is communicating a distinct message. There appears to be a gap. It's not solely about combating the flu. The immune system plays a crucial role in preventing long-term diseases, monitoring for cancer, protecting cardiovascular health, and facilitating wound healing. Consistent sexual activity contributes to hormonal equilibrium, diminishes stress hormones such as cortisol, and enhances blood flow, all of which are vital for supporting the immune system. Once that is gone, the chain reaction starts. Heightened stress levels lead to poor sleep quality, increased inflammation, and a decline in your body's overall strength and vitality. A woman in her 70s shared with me that she hadn't engaged in self-exploration for 5 years following the loss of her husband. After an open discussion regarding the link between sexual activity and immune function, she chose to explore that aspect of her life once more, not for desire, but for health. Months later, she came back with a renewed sparkle in her eyes and an abundance of energy. "I can't quite put it into words," she said, "but I feel a renewed sense of vitality, as if my body is cooperating with me once more, rather than opposing me. That's not an illusion." That's the outcome when the body receives the necessary signals, messages that convey our presence and our desire to flourish. It can be simple to ignore, brush aside, or feel uncomfortable discussing. However, your immune system remains unaffected by feelings of shame. It solely reacts to activity. Engaging in sexual stimulation, even alone, is a potent act that communicates vitality and resilience throughout every cell in your body. However, diminished immunity can make your body more vulnerable to illness, and the ultimate impact of disregarding self-intimacy could penetrate even further, affecting your core sense of self. When you cease to engage with your own body, you might gradually lose awareness of your true self. Let's examine how neglecting oneself can subtly diminish your sense of self-worth and what steps you can take to restore it. 7. Loss of body, ownership, and self-worth stands out in my memory, particularly a quiet conversation I had with a patient in his late 70s. He was a retired school principal, once self-assured, sharp-minded, the type of individual who used to hold the attention of everyone in the room. However, during his routine checkup, there was a noticeable shift in his posture, shoulders slightly slouched, gaze somewhat duller. During our conversation, he let out a sigh and expressed, "I don't really feel like I inhabit this body anymore. I feel as though I'm merely existing within it." That statement lingered in my mind. What he described is quite typical. I've encountered this sentiment expressed by individuals of all genders, articulated in various ways, yet conveying the same fundamental reality. At some point, they began to lose the sense of comfort within themselves. Frequently, it begins with a lack of communication. By relinquishing self-intimacy, dismissing it as something no longer essential, too late in life, or a phase I've outgrown. However, what truly occurs when you cease to engage with your body, when you no longer focus on it in such an intimate manner, you start to detach from it, gently, silently, and at times, it can be lasting. Self-exploration goes beyond mere enjoyment. It's about being there. When you engage with your body, even softly and without a specific aim beyond sensation, you reassure your nervous system of your presence. Your significance is undeniable. Your body remains an integral aspect of your identity, rather than merely a vessel you anticipate departing from. Without that, there is a shift. An emotional and psychological distance develops. It can be tempting to overlook minor discomforts, to avoid self-reflection, and to convince oneself that this phase of life doesn't deserve attention. And that is the most perilous loss of all. The diminishment of your personal value. This disconnection can result in profound emotional numbness, feelings of shame regarding aging, a retreat from physical affection, and even a diminished drive for essential self-care. Individuals often neglect physical activity, healthy eating, and purposeful dressing. Why should I care, they wonder, when this body seems foreign to me now? A woman shared with me that she hasn't engaged in self-exploration since reaching menopause. Reclaiming your body through self-touch is not about experiencing sexuality as you did in your 20s. It's about recognizing and valuing the vitality that remains within you. It's about expressing, "I continue to be present. I continue to experience feelings. I still deserve recognition, even alone." When you reconnect with your body, even in the comfort of your own space, you start to undo that subtle neglect. It's important to recognize that growing older doesn't mean disappearing. Your value remains intact beyond your younger years. Returning to your true self can be one of the most restorative experiences imaginable. As we reach the conclusion of this journey, let's bring everything together cohesively. Each of these 7 consequences carries its own significance, but together they weave a much larger and more pressing narrative. In the concluding message, I aim to illustrate precisely what is on the line, and even more crucially, how you can regain control beginning today. Concluding reflections. restoring closeness, restoring well-being, reflecting on the years dedicated to supporting older patients. What resonates deeply is not merely the medical hurdles they encounter, but the subtle, unseen burdens they bear. Losses that are not detectable through laboratory tests or imaging studies. A man who once exuded confidence now shies away from reflections. A woman who once exuded happiness now expresses that she hasn't experienced any sensations in her body for years. Frequently, individuals have been informed that this is merely a natural part of aging. However, I have my doubts about that. Not at all. If you've followed along this much, I believe you might feel the same way, because this is the reality. When you neglect your sexual health, when you disregard that aspect of your body and identity, a series of subtle repercussions starts to unfold. We have discussed each of them individually. The decline in prostate and urinary health when regular release is restricted. The brain becomes less clear and sharp when it lacks adequate stimulation. The lack of physical intimacy can lead to depression, disrupt sleep patterns, impair circulation, and potentially weaken the immune system. And perhaps most distressing of all, how relinquishing that intimate personal bond with your own body can gradually erode your sense of value until you feel like a foreigner within yourself. These are significant matters. These are not merely a consequence of getting older. These are indicators that your physical, mental, and emotional well-being require your focus. I've encountered individuals who appeared shattered, detached, and devoid of feeling. I've witnessed the remarkable change in their expressions as they start to take back control of this aspect of their lives. It stands alone. It doesn't require vitality or flawless well-being. It solely takes your consent to recognize your own value in experiencing intimacy, particularly at this moment, and even more so now. This is a topic that often makes many individuals uncomfortable. Many individuals feel a sense of embarrassment. Many individuals were not educated on the importance of maintaining their sexual health as they age. But I want you to hear this from a medical professional who has guided thousands of men and women through this journey. It is not just acceptable, it is crucial. Masturbation in later life serves a purpose beyond mere indulgence. It involves circulation, clarity, hormonal balance, emotional grounding, immune defense, and identity. It's a necessity. It represents a type of medical attention, a statement affirming your continued existence in this body and your ongoing responsibility for its health. A patient once shared with me, "I didn't recognize how much I longed to feel like myself until I finally connected with that part of me again." This is the focus of our discussion, not merely existing, but truly thriving, not merely enduring the passage of time, but fully engaging with it through presence, dignity, and joy. If you have overlooked this aspect of yourself, hidden it away, or formed judgments about it, I encourage you to take a moment to reflect on it anew, to re-establish a connection. Always keep in mind that your body remains attentive, fully functional, and worthy of care. Begin with manageable steps, with a sense of inquiry, with compassion. However, the key is to begin. By prioritizing this aspect of your well-being, you are not just safeguarding your health, you are also taking back control of your life. If this message struck a chord with you, feel free to share it. Enjoy this video, pass it along to someone who could benefit from it, and share your feedback in the comments below. Your perspective is important, and sharing your experiences can resonate with others who may be going through similar situations.